All right, we might get started. My name's Caitlin. I'm part of the community engagement team here at Holstep Health, and we provide the Carer Gateway service in Victoria. I'm joined today by Kelson and Molly, so I might get them to introduce themselves and then we'll get started.
Thanks, Caitlin. I'm Kelson. I'm a care support coordinator at Family Care, which is the local care gateway outlet for, I guess, Northern Victoria. We cover pretty much from Mitchell Shire all the way out towards Moira, Strasbourg, all the way up to Echuca. We go as far as King Lake. I've been a part of the Care Gateway program since about 2021, so I've been around the block for a while. I'm the major face of carer support in Lower Hume. I'm based out of the Mitchell Shire Wallen office for adult carers. And yeah, Molly is the young carer specialist in Lower Hume. She'll introduce herself now.
Hi everyone. Yes, I'm Molly and I work with young carers. And I do the same thing, assessment and planning and tailoring, the supports to the young person, the young carer. So really the only difference between me and Kelson is that, the way you work with a 7-year-old or a 14-year-old is going to be a lot different and a bit more flexible. And yeah, been in the role for about 4 years, supporting young people and trying to get the word out about young carers specifically, because they're definitely underrepresented. And like most carers, they just don't think that they're a carer. So that's me.
Great, thanks, Molly and Kelson. So before we get started, we just like to do an acknowledgement of country. Holstep Health acknowledges the traditional custodians of the land, waterways on which we work, and we pay our deep respects to elders past and present. We recognise that sovereignty was never ceded and that Aboriginal and Torres Strait Islander people maintain an enduring connection to country. We understand that health and wellbeing cannot be separated from justice, truth and self-determination. Holstep Health acknowledges the strength and resilience of Aboriginal and Torres Strait Islander people and affirms our responsibility to work alongside First Peoples in achieving equity and healing. We'd also like to acknowledge carers and their lived experience. We acknowledge, promote, and value the role of carers and the important contribution that people in care relationships make to our community and recognise the unique knowledge of that carers hold about the person they care for. We acknowledge that we can only provide quality care through valuing, respecting, and drawing upon lived experience and expertise of consumers, their families, carers, friends, staff, and local communities. So I just wanted to start off today by sharing this visual of the same storm and different boats. So today we're going to be going through a little bit about Carer Gateway and carers, but also sort of specifically focusing on rural and regional carers. And I guess this kind of highlights that some carers face, I guess, different challenges, and they're sort of in a different sized boat, and that sometimes it might be harder to deal with the things they face because of the factors surrounding them. So first, we just want to let you know who carers are. So a carer is someone who provides unpaid support to a family member, friend, or partner with a disability, mental illness, chronic health issue, or age-related condition. There are 3 million carers in Australia and nearly 800,000 in Victoria. Some common signs that you're in a caring role is that your support is ongoing and could last longer than 6 months, and you're regularly helping someone with everyday tasks. Or organising services. You're still a carer even if you provide support for just 1 to 2 hours per week. So what's Carer Gateway? Carer Gateway is a national program funded by the Australian government and connects unpaid carers to free services and supports. Carers are the central focus of the Carer Gateway program. Is that showing the presenter view or is it still just showing the slide?
Slide view.
Just the slide? Okay, great. Sorry, I couldn't see my notes, so I wasn't sure which slides I was doing. So in Victoria, Carer Gateway is run by 7 different consortia partners. You can see here in the metro region, it's supported by Whole Step Health, Alfred Health, and Uniting Vic Tas. So wherever you live in Victoria, you can call Carer Gateway on the 1-800 number. But we really also just want to highlight that in the regional area, there are specific so these are our Barwon Health, Grampians Health, Bendigo Health, Family Care, and Uniting Vic Tas support carers in these local areas. And so when you're contacting Carer Gateway, you are talking to a team who are based in your local area, like Kelson and Molly described. They sort of have specific regions that they focus on. So to be eligible for the Carer Gateway, you just have to be a carer for a family member, friend, or partner, and be in a caring role that's ongoing or likely to be for at least 6 months. This isn't applicable to palliative care or recently bereaved carers. And there's no citizenship requirements, residency or visa requirements. The program's not means tested, and it's not affected by other government supports, including carer allowance or carer payment. Going to throw over to Molly now.
So how do you get in touch? It's a simple process. You can call Carer Gateway no matter where you live. You call the 1-800 number, or you can jump online and there's a self-referral form there too. Once you've made that referral, they'll do intake over the phone with you, just get your details, what's happening, and get you in touch with your local provider, or they might book an appointment directly with your local provider for you. Once that appointment is booked, for instance, if you're in our area, you would be met, you would go with Family Care, and we would sit down with you and do what we call a carer star. And that's our assessment process. We would talk about all the areas of your life and how caring may be impacting those areas. And from there, that's when we're determining, okay, well, what support is needed, what's impacted, and how can we help? It's also where you may have an idea of what support you would need or require. Once we figure that out, we implement the support, put in the referrals or whatever it may be. And the last step would be a check-in. So that is like, doing a bit of a check-in with you, making sure all those goals were met, if we put in services, making sure that they've put in the service that they were required to do. So if you ever needed, once all of that flow sort of support chart is completed and we have closed you off because we are a short-term support, that you can re-engage. So, 6 months down the line, we've closed off and something else has come up and you want to check and see if there is any further support we can provide, or 3 years down the line, whatever it is, you're always calling the 1-800 number. And that just means that if you move areas or the local provider changes for whatever reason, you don't have to remember who's who and, who you spoke to or whatever. You're always calling the 1-800 number when you're needing support for being a carer. So the supports that we could provide is listed here. So emergency and planned respite, counselling, coaching, in-person peer support, carer support planning, tailored support packages, information advice, and online support. Like I said, all of our supports are short-term. So if we were going to put in respite, it's not going to be 6 months, 12 months, lot of respite. We are only short-term. So from our carer support chat, so the carer star that we've done with you, that will help us identify what services or supports from this list that we would be implementing for you. Every single care is different. Every single, situation is different. And yeah, it's just really trying to understand who you are as the carer and your needs, so that we can figure out what services are available. Some of these are available online and like self-paced. So like some of the coaching that can be done at your own pace online, which is really handy. And a lot of the supports that your coordinator, like me and Carlson, the very valuable stuff is just a lot of that information and advice. Making sure you got the carer's card, all the, travel reimbursement, the young carer bursary, all of these things that are available to carers that you just, don't know about, or it's constantly changing. That's why we're here. We keep up with all of those. And we can let you know about those other little things that are long term that would, continue to provide you support.
All right, so we're now going to talk a little bit about what caring roles actually look like in regional areas, I guess, in comparison to probably more metro-based carers. Some of the key things are that regional carers often do a lot more traveling to maybe neighboring towns or regional cities. So there's longer travel time, which is obviously time is a big resource for carers, and they're having to find more time to attend medical appointments, because instead of having to maybe drive to, 10 minutes down the road to a neighboring suburb, you're having to drive, your 60 minutes to, a regional city like Shepparton or maybe Bendigo, or even some of your specialist appointments might be based in Melbourne at some of the bigger hospitals, like Peter Mac or the Alfred or Royal Children's, caring, obviously. It obviously depends on each situation, but they're some of the big things. So we often also see smaller capacity lists in regional areas. There are less resources from a provider perspective as well, in terms of less staff or staff they might have overlapping experience and multiple roles. So what I mean by that is you might have a pediatrician who might also be a occupational therapist, and they might play multiple roles at, your local clinic on different days. So they play multiple roles. So the ability to access some of those supports can be more difficult because they're not as available as some of the other metro-based services. Some of the other things that we talk about, which are, I guess, additional challenges that we face as rural communities, is simply that some of those services aren't even available for you to access depending on your location. Some smaller, more, I guess, remote areas, where a lot of people might be retired and living rurally, there just isn't a provider that's available to you. And if there is one, there can be increased costs associated with transport in terms of the service provider actually coming to your residence to provide a service, whether that be something like a personal care attendant providing you with a shower or your care recipient a shower, or maybe a gardening service, or even something like allied health, like nursing in the home. All those services do sometimes charge mileage or kilometers, which if you're in a rural area, the kilometers and mileage is usually higher, which then means, cost is a big factor, which can sometimes prevent carers from accessing that support. The other challenges that we see commonly is, as a result of not being able to access those services and supports face to face at times, carers are having to go online, which has its, challenges as well as some benefits. Obviously, beneficially, you have the access to the service, whether it be something like a counseling service or like a peer support service. It can be delivered by telehealth or Zoom like this. But a lot of people might not enjoy that type of style of service. They might not feel they can build trust with their counselor and establish like a personal connection, or they might have issues with technology and not be confident with actually navigating and accessing, video links, or they might not have they might not have internet, or they might not have a laptop. All these things impact regional carers, I guess more so than metro-based carers. So there are some practical ways that carers can access support through the gateway. Some of the things that we do is we teach people how to access relevant long-term supports through all avenues. So whether that be through something like My Aged Care if you're over 65, or whether it be something such as NDIS if you're under 65 and have a permanent disability, or whether it be even accessing things like care-related entitlements through Services Australia, whether it be a carer pension or a carer allowance. We look at trying to connect people with relevant ongoing support programs. It's a big part of our role, as well as providing that short-term practical supports. For example, if somebody maybe broke their arm or had a fall, or they became unwell, either got a chronic flu or an episode of hospitalization, we might provide short-term practical supports to help that carer recover and get through that episode of stress. Whether it be providing support with basic day-to-day tasks like cleaning or maybe showering, or we can provide assistance with transportation to attend appointments if people can't drive. All those kind of things can be tailored depending on your need. We also then have some mental health supports. We've got phone-based counselling, as well as we can link carers in with local face-to-face counselling options as well. It just obviously depends on the situation and the carer's preference. We do try and, although we as coordinators do kind of do our best to plan and assist carers, we are ultimately driven by what our carers tell us and what our carers want to do. So if you're really not into phone-based supports, we're going to do whatever we can to connect you with a face-to-face option. Awesome. So outside of the practical supports, there are some other supports that the Gateway can, I guess, provide or is aware of. So some of the other supports outside of the Carer Gateway are funded Victorian Government Support for Carers program, which is a program that us at Family Care have access to outside of the Carer Gateway, but it's very similar in terms of it's a program that is to support carers, it's in the name, through other streams, whether it be funding things like equipment or other short-term practical needs. There is a program called the Home and Community Care Program for Younger People, or we call it HACC-PYP. This is similar to the aged care, My Aged Care, but it's for people under the age of 65 and that don't meet criteria for the NDIS. We then have Support at Home, which is the new My Aged Care program. It was previously known as the Home Care Package program. This transitioned in November 2025. So some people are on the old program still, and it's kind of grandfathered. Some people are assessed. If you're a new carer, you're probably being assessed under the new program now. So you might know it as the Support at Home program. And sitting underneath the Support at Home program is a program called the Commonwealth Home Support Program. This is either an interim support program for people that are waiting for their support at home allocation, or they might not meet criteria for that program. They might still have a condition that prevents them from attending to some basic day-to-day tasks. But their health conditions might not be as serious as some other people, and as a result, they still need some support, but not quite the same level as somebody that is eligible for support at home. Then there are other programs such as post-acute care. This is a program that is provided through the public health system. Upon discharge from hospital, you might need some increased support. If you had a fall and you broke your arm, you might need some assistance with showering or vacuuming or something like that. Post-acute care is your immediate hospital discharge program that can provide practical support to help you in that period. And often during that time, a carer might register with us, and post-acute care can provide support while you're waiting for your appointment with us to then kind of follow up and follow on from that program. So that is a short-term program. Generally, it ranges from 4 to 12 weeks upon discharge. There is then a transitional care program, which is, it's in the name, helps people transition often after a big episode of rehabilitation back safely at home through implementation and provision of allied health and support around, occupational therapy or physio, those kinds of things. And then the final support that we commonly talk about is the end of life pathway, which end of life can always be a bit of an uncomfortable conversation to talk about if it's not, like, it's a bit taboo, I guess. It's not a comfortable space to be in, but it is a part of life. We talk about it quite routinely at the Gateway. Unfortunately, we're working sometimes with some people who are quite unwell. But the end of life pathway is an excellent program which has recently been implemented by My Aged Care and the government to assist people that is given a terminal diagnosis and that I believe have been given approximately 3 or less months to live. Pretty much just providing as much in-home support as possible to that individual. It's like a special program for those situations, but it's to pretty much provide as much support to make that carer and recipient's end of life as comfortable as humanly possible. Obviously, it's a really challenging time. The last thing you want to have to worry about is finding funds to shower or manage cleaning the house or get meals or anything like that. So that pathway helps provide as much support as possible. Beautiful. So there is a bit of stigma and reluctance to seek assistance in rural communities, as I'm sure a lot of you rural carers will know. Some of us live in quite a small town where word can travel fast. You might not feel comfortable speaking to somebody because you're not sure where, that might go. People pick up on things, and as a result, sometimes we then don't share, and we take on that load, and keep it, quite close to our chest, and that can build up a lot of, stress or resentment or various other emotions. So we find that there are a lower number of regional carers that actually want to access support for things such as counseling and coaching. And I guess it's another thing that people feel it is just their duty to be a carer. I think Molly mentioned that quite a while ago. Some people go, it's my wife or it's my husband or it's my child or, it's just my duty. And if you want to look at it from, religious perspective, in sickness and in health, and that's your vows if you're married. Some people might feel that that's still the same, and it is, but at the same time, just because you feel like it's your duty doesn't mean that you can't get a bit of support to help you actually manage what you feel like is your obligation and responsibility. We want people to feel like if it is their duty, that they are supported in that journey and have the supports around them to manage. Awesome. So I've just got a bit of I guess, an example of what an experience of a carer that we've recently worked with, what it actually looks like. Bit of a case study, I guess, for you. So we had a 73-year-old woman, and she was living in a small regional town. And her care recipient had a specialist medical appointment at one of the big Melbourne hospitals. We kind of mentioned earlier in the presentation that, due to distance, the time to get there is increased and can be quite difficult. We did have a look at some transportation options to assist that person actually attend their appointment. However, due to that distance and the client's actual ability or the care recipient's ability to function, even with support from their carer, it took them a significant amount of time to get ready to actually, wake up in the morning, make sure they have their breakfast, have their shower, and actually be fit, dressed and actually be fit and ready for their appointment. So as a result, we looked at funding a disability supported accommodation option close by to the hospital. That way that the carer didn't have to drive the same day of their appointment into the city to attend the appointment. They got to stay close overnight, and have plenty of time to be ready for their appointment the next morning. So this is kind of just an example of, as a result of the carer's distance from supports from Melbourne, they had harder challenge actually attending that simple appointment, which somebody in Melbourne might be able to do quite easily just due to distance and location. And as a result, it's something that us as a regional outlet would provide that maybe a Melbourne-based provider might not, because given the distance and time, if you are regionally, you might not be able to make it to that appointment without some support. So that's just an example of some supports, or an example of what it looks like to be a regional carer, and an example of how we would support you in that example compared to someone who might be Melbourne or metro based. Yeah, just a little bit of an example there. So I'll hand it over to Molly.
Thank you. My example is about young carers, being the young carer coordinator. And I just want to say, a young carer is anybody under the age of 25 that is in a caring role. So same as any other carer, providing unpaid support to a family member or a loved one with a disability, chronic illness, maybe they're aged, or they've got mental illness. For young carers, they do face a lot of difficulties just because they are young, not having access maybe to transport, not being independent, having to rely on, parents or whoever to get them about. And often that parent is maybe also in a caring role that, they're limited time and all of that. So trying to find young carers is often challenging as well, on top of them feeling, yeah, it's their duty, as well as, you guys may feel that in your own caring roles. But they're also faced with the challenge of a parent or their guardian who is doing everything they possibly can to make sure that that young person isn't feeling a burden or a responsibility to be in a caring role. But often they still do, and being just part of the family, they are in a caring role because they're providing that emotional support to their sister with autism, or in this instance it's a grandfather that's palliative care and she goes to visit him. Young carers, they're often relying on another adult or somebody to say, oh, yep, that's you, you're a young carer, here's the support. So they're often not putting up their own hand. So in this example, there's a 12-year-old girl in very regional community, and she actually had a past caring role for her father, who went through palliative care and sadly did pass away. And so I supported her back then. And then she re-engaged and, sad to hear, but her grandfather is now also in palliative care for cancer. And so she connected back up with Carer Gateway and was connected with me to support in that role. So we chatted about what she was doing in her caring role and what she wanted to do and the challenges she's faced. And what she came up with was that the biggest difficulties she had was visiting friends or engaging in the community because of the distance, the travel. Like Kelson said, it's always comes down to travel and distance and things like that. And finding the activity or the thing that she wanted to go and do as well. So she felt such a responsibility to help her grandfather. Her mum was so busy also being a carer for her father-in-law. And it was really hard for that young person to be able to go see her grandfather when she wanted to. She felt like I needed to be there. I wanted to go see him, but mum's too busy to take me. She's working late. She's doing this. So yeah, we talked about that. We talked about how it was impacting her emotionally and socially, not connecting with soccer or hockey or all the things that she loved to do. One, because, mum was extra busy now being in her own caring role, and not being able to get there, not seeing her friends because she'd either, be too worried, too stressed, not be able to get there, or want to go see her grandfather instead. So out of all of that, what we came down to was that we wanted to increase her independence. So we wanted her to be able to visit her grandfather as much as she wanted to. It was sort of like walking distance, a fair long walk, but he did live in the same town, which was good. And we wanted her to be able to go see her friends. So we were able to fund a bike so that she could jump on her bike after school and go see a friend. She went down to the pool to meet her friends. She was able to go do soccer or hockey, her sport that she loved. And then she was also able to go visit her grandfather without needing to bother mum. So it was a lot of just a stress relief to be able to be more in control of her own life and be more connected. So we were able to improve the access and social opportunities for her while she was balancing her carer responsibilities. So this was through a tailored support package, and yeah, it just makes a huge difference in her life. And it's an example of how we are tailoring the support to each and every carer that comes through. So
Thanks, Molly. We've run over time, so we won't have time for questions today. But I just want to pop up here our contact details to get in touch with the Carer Gateway. We will send you a follow-up email with the recording from today. And so if you do have any questions, you can reply to that. But thank you again for everyone who attended. It was great to see a few people here. And thanks again to Kelson and Molly for presenting with me.
thank you.